Welcome to an hour of HealthMade Radio. HealthMade is a community for natural health seekers where we educate people about common health conditions and share extensive research on the most effective natural health treatments and promote legislation that protects our health freedoms. A core concept belief is in the innate intelligence and healing power of the body, and if properly supported spiritually, emotionally, and nutritionally, it can find its way back to health. HealthMade Radio will bring information from integrative health experts throughout the world. Health is what you make it. I'm Dr. Michael Karlfeldt, and I will be your host. Today's guest is Dr. Sylvia Menendez. Dr. Menendez is one of the most respected and experienced medical ozone researcher in the world. She has a Ph.D. in chemistry and is a full researcher, introduced ozone therapy in Cuba in 1986 and was head of the Ozone Clinic of the Ozone Research Center, belonging to the National Center for Scientific Research until 2011 when she retired after 25 years. Dr. Menendez has dedicated her entire professional life to studying and promoting the use of medical ozone in a wide range of ailments and continues her involvement by teaching in a wide variety of settings. She's the author of 2 patents, 2 medication registrations, and a new therapeutic indication for ozonated sunflower oil, as well as 2 books, chapters of books, and more than 50 articles published in peer-reviewed journals for the past 15 years, all in the field of ozone therapy. She has supervised over 40 theses, imparted 60 national and international courses, and participated in over 130 international scientific congresses with 260 research works invited to countries such as Spain, Italy, Austria, Germany, Brazil, Mexico, Argentina, Colombia, Peru, USA, Barbados, Japan, Egypt, and India to offer lectures. She has received several medals and international and national awards for her work deployed in the field of ozone therapy. Dr. Sylvia Menendez is co-founder and chief of the scientific committee of O3 Crowd. Her selfless dedication to O3 Crowd represents the continuation of her commitment to give medical ozone the recognition it deserves in the field of medicine. Dr. Menendez, I am so honored and pleased to have you on this show today. First of all, for all the listeners out there, I mean, we know oxygen, we know that is O2, but what is ozone?
Well, ozone is an allotropic form of oxygen containing 3 atoms of oxygen. It is particularly unstable and decomposes spontaneously into diatomic oxygen, which in practice make it very difficult to transport and store. Because of this, it is necessary to obtain it in the place and time for its usage. It is a powerful oxidant agent and very selective in its reaction. Over the Earth's surface, ozone was detected for the first time in 1785 by the German physician Martinus von Marum, when perceiving a peculiar odor generated in zones close to machines working with electricity. However, 1814 is recognized as the year in which Christian Friedrich Schonwein discovers and names it ozone, which comes from the Greek ozoin, that means odor.
So, just to clarify, you have oxygen, which is 2 oxygen molecule being then O2, and then ozone is then 3 of those together, being then O3, but it's very, very unstable. So the beauty of it then is that it then gives off that extra oxygen molecule, or oxygen atom, I should say. I'm sorry, not molecule. Oxygen atom, and that is what makes it very powerful. It becomes a very that powerful oxidative agent when it gives off that extra oxygen atom. Is that correct?
Exactly.
Okay, perfect. So how long has this ozone therapy been around? When was the first time that they used it? Is this something new?
Well, ozone was used for the first time for therapeutic purposes during the First World War to heal wounds and fistulae. At that time also was used in patients with rectal and gynecological cancer. Then it's a lot of time that we have known ozone in literature.
Okay, so it's been around for quite a while. And so even in the First World War, they were using it then to heal wounds. So how does it heal these wounds? Is it just the oxygen that helps to regenerate the tissue?
Well, in that time it was very difficult to transport ozone because it reacts with caoutchouc, with rubber.
Oh.
And then they have to use gutta-percha. That is something that helps to transport the ozone. And also the device were very not very bad. Yes. Because of that characteristic of ozone. But even that, they use it and they cured the ulcers that have formed in accidents because of the war.
Oh, so how come they stopped using it if it was so powerful?
Well, because then appears the antibiotics, the sulfas. The procedure of ozone was not easy because plastic was not invented yet.
Yes. And
also there are other factors that can be considered. For example, up to now there are methodological mistakes in using ozone, both in preclinical and clinical studies, or we have an incomplete knowledge of the biological mechanisms of action. There are not enough publications, and most of them have been published in unknown journals. We need to publish in peer-reviewed journals. Maybe we have also lack of standardized procedures, therapeutic dosage, scheme of treatment, lack of financial support for preclinical studies, because they are very, very expensive. The relevance of the placebo effect, emphasis on ozone toxicity because we cannot breathe, commercial interest and prejudice, and also it is hard to understand how a therapeutic procedure can be effective in so different physiological states like vascular disorders, chronic ulcers, immunological diseases, or in the nervous central system. You see, they have several possibilities that makes ozone that is not accepted as medical therapy.
So this is, I can see that there's even though it seems like it's such a simple little substance. I mean, it's just 3 atoms of oxygen, but still there's so much that we don't know about it. And as you mentioned, there's just not enough. It takes a lot of money to do these studies, and if whoever the company is or whoever the entity is not making money on ozone, then why should they?
Because it cannot be patented.
Exactly. Yeah, it's a natural substance, so you can't patent it. Absolutely. And and then because of that, then it becomes more kind of that anecdotal research, meaning you have all these practitioners that use it and then see what kind of impact it has, but it does not end up in medical peer-reviewed journals.
Exactly.
But you in Cuba, you have used it for 30-some years right now.
Yes, more than 30 years, and is accepted for the Minister of Health.
Really? And how many, out of curiosity, how many treatments do you think have been done in Cuba of ozone?
I think that more than 2 million patients have been treated with ozone.
And has there been any kind of negative impact from those 2 million people?
If you apply correctly, we don't have any important side effects.
That's amazing.
It's a very safe treatment.
Yeah.
No invasive treatment.
Wonderful. And then compared to then all the different pharmaceutical drugs that we are dealing with, they all have adverse reactions.
Exactly.
Yeah.
No, and sometimes we can use ozone with the conventional medicine in order to reduce the dose of that conventional medication.
So we can actually then reduce a negative impact.
And then we reduce the negative side effects.
Yeah, absolutely. Wonderful. And so how can a person then really benefit from ozone? And what does ozone actually do in the body? What do we know about ozone?
Then we can say first that ozone is an oxidant agent and very selective. Then ozone must dissolve in plasma or in extracellular fluids or in the fine water layer that covers the skin or the intestinal mucosa, vagina, etc., independent of the different way of ozone application, of course. And due to its great reactivity, it reacts with compounds such as antioxidants, proteins, carbohydrates, and mainly polyunsaturated fatty acids found in high percentage in the organism fluids and cell structures. Ozone's reaction to such variety of molecular compounds imply two essential processes. We have an initial phase of reaction in which, despite great part of ozone is consumed by the antioxidant present in the plasma, an amount of reactive oxygen species is formed and is capable of triggering some biochemical pathways, and a later phase in which lipid oxidation products are formed, such as peroxyl radicals, hydroperoxides, complex mixture of aldehyde final product with low molecular weight, and also hydrogen peroxide. All these active metabolites are responsible for ozone therapeutic effects as, first, improve oxygen release by the red blood cells. Then in all hypoxic states, we can use it. Maintain the cell redox balance, activating the antioxidant defense systems that counteract the excess of radicals. And this is important because he is an oxidant, but creates antioxidant defense systems. In modulation through activation of the white blood cells, intervenes in the release of growth factors and alkaloids. Therefore, its analgesic and anti-inflammatory effects, regulates metabolism, germicides of the wide spectrum.
That's amazing.
Then we can say that ozone, and I repeat because it's very important, that being a powerful oxidant may induce an adaptation to oxidative stress or an oxidative precondition that under control and therapeutic doses by means of a slight and transient oxidative stress may stimulate the endogenous antioxidant mechanism preparing the host to face physiopathological conditions mediated by reactive oxygen species. Ozone does not deplete antioxidants, totally the contrary. Thus, ozone activates a group of depressed biological functions without causing any adverse effect. This ozone oxidative preconditioning effect is capable to rebalance the upset redox state in the organism by some pathological stimulus. This ozone selective reactivity for the formation of lipid oxidation products and reactive oxygen species favors direct activation of erythrocyte metabolism. It is possible that during autohemotherapy, this is one of the way of ozone application, some traces of lipid oxidation products present in ozonized blood may activate differentiation at erythropoietic level, favoring formation of new gifted erythrocytes, gifted because those erythrocytes has improved biochemical characteristics. If this is true, with each ozone therapy session, the bone marrow will release groups of new erythrocytes capable to satisfy the increased energetic and biosynthetic requirements imposed by the ozone treatment. For example, clinical improvement observed in patients treated with ozone therapy do not end after treatment, but remain for about 3 to 4 months, something that must be related to the life extension of those highly gifted erythrocytes present in the circulation. An increase in oxygenation and beneficial effects of ozone therapy in ischemic diseases could be associated to micro-release of ATP, of erythrocytes, and dilatation of blood vessels found. You can see we have a lot of benefits with this procedure.
That's amazing. That's absolutely amazing. I'm going to, when we come back after this short break, I want to just ask a little bit more about these things, because that's absolutely incredible what you just told us. We'll be back in just a moment. We're back, HealthMade Radio with Dr. Sylvia Menendez. We're discussing ozone, the benefit of ozone, and medically how we can use it. It was really incredible, the information that you just gave us. We look upon ozone as an oxidative therapy, which means that it breaks down things like protein, carbohydrates, fatty acids, which are some of the main substances that we have in our body. But what you're telling us then, that this, in addition to then forming this oxidative, forming then these different what's called peroxyl radicals or hydroperoxides, and that is actually some of the therapeutic substances that are then impacting our body, where we can then use it as a kind of germicide, where it helps to kill off pathogens and also maybe then oxidize, things that even cancer cells, because, it gives hydrogen peroxide. It can then create a oxidative burst within the cancer cells. So that's really amazing. In addition to your mentioning that one of the huge impacts is that it helps in the formation then of red blood cells in the bone marrow, and these red blood cells, they are almost like they're supercharged. They're much healthier, and they have these, like you said, improved biochemical characteristics. So they just stimulate each ozone treatment. A common way you mentioned it was directly that you get it directly into the blood. It then stimulates the production of these red blood cells, which then increase oxygenation throughout the whole body and also increase energy production throughout the whole body. And this benefit just at their treatment, then you mentioned, can last 3 to 4 months, because the lifespan of a red blood cell is 3 to 4 months. So did I kind of summarize it somewhat accurate, or what do you have anything else?
Perfect.
I did good? Okay, thank you.
Yes.
And so here we have, then you mentioned, it improves the oxygen release by the red blood cells. So here we got more oxygen because of the ozone therapy. And also it maintains the cell redox balance, which means that it actually helps, because for a body to function properly, we need to be able to oxidate, but we also need to reduce, which means that we need antioxidants. And we know antioxidants like vitamin C, selenium, vitamin A, E, those are the common antioxidants. So when we're thinking of an oxidative therapy, like ozone therapy, we're just thinking that it depletes us of antioxidants, but in essence, it actually builds up our antioxidant defense. So if, for instance, we use a therapy like chemotherapy, for instance, which is a very oxidative therapy because it oxidizes then the cancer cells, but it also oxidizes the rest of the tissue. So if we use something like ozone, that would be it would help to protect those cells that should not be oxidized by
exactly, the healthy cells.
The healthy cells. So, but it doesn't negate then the chemotherapy effect, correct?
Yes.
Yeah.
It potentiates the chemotherapy effect.
Yeah. So here you have then a therapy that potentiates the chemotherapy, and because it is an oxidative therapy, just like chemotherapy, but then at the same
minimize side effects.
Yeah, exactly, and minimizes side effects because it then stimulates the production of antioxidants in the healthy cells, correct?
Exactly.
Yeah, so now the healthy cells are able to protect themselves from chemotherapy, but then the the cancer cells are getting like a double blast because they don't have the ability to protect themselves from the ozone nor from the chemotherapy. One. And then also you were talking about it has an immunomodulating effect also. What does that mean?
Well, that means that we can use ozone in diseases, for example, VIH, that we have a depressed immunological systems, or we can use it, for example, in rheumatoid arthritis, where it's totally the contrary, because it produces an immunomodulation. It produces sometimes activates the pro-inflammatory cytokines and otherwise activates the anti-inflammatory cytokines in order to have an equilibrium, because ozone is based in equilibrium, because health is the equilibrium of the force. Then ozone, we achieve with ozone that balance.
Wonderful.
At all levels, as metabolism also.
So because we have such a mindset in the medical community that either you stimulate the immune system or you suppress the immune system. So if you're dealing with an autoimmune condition like rheumatoid arthritis, you mentioned, you get Crohn's, you have ulcerative colitis,
scleroderma, there's a lot of them.
Scleroderma, all these different autoimmune disorders, then we're so used to that we need to suppress the immune system. But to use ozone, you actually then give the immune system intelligence to not be hyperactive where it shouldn't be, and then to be active where it should be. So it's much more, and makes it just more intelligent. Wonderful. Well, we'll be back with Dr. Sylvia Menendez in just a little bit. You're listening to HealthMade Radio, and I'm Dr. Michael Karlfeldt, your host, and I'm speaking with Dr. Sylvia Menendez, one of the leading experts in the world in the area of ozone therapy. So we chat a little bit about the immunomodulating effect of ozone, but also you mentioned that it has the ability to support the release of growth factors, which means tissue repair, correct?
Yes, that's very important as tissue repair.
Yeah, so how tell me a little bit more about that.
Well, we are now using, not only in Cuba, but there is a lot of countries that are using the PRP, plasma-enriched platelet, ozonized plasma-enriched platelet, in order to increase the quantity of growth factors. And this growth factor can be injected, for example, intra-articular, when you have knee osteoarthritis, for example, or any problem in joints. And also they are using in cosmetology.
So people can then use PRP, which is you extract a little bit of your blood, you spin that blood, and then you collect certain aspects of that blood, which is in what's called platelet-rich plasma, or PRP, and then you activate that with ozone, and then you can inject that into the skin to make it healthier and make it repair, and so it's like anti-aging then.
Exactly.
Wonderful. And then obviously if you can do that in the skin, you can do that in joints and into the back and into any kind of tissue.
No, they are using now. Very good results.
What kind of results are they seeing?
Well, they are trying to repair the joint, to regenerate the cartilage.
And that actually, so has there been where you can see cartilage growing, repairing?
We improve.
Wonderful. And also pain-wise, because
And of course, the pain, yes, we of course, we diminish the pain.
Because we're dealing with a crisis where you have the opioid crisis, and you have more people are dying from pain medication probably than any kind of medication out there. So to use an ozone instead to relieve pain and also to regenerate tissue, that seems like such a better option.
Exactly. We always have time for surgery. We try to do first everything in order to avoid surgery.
And that's exactly what I tell my patients is that you always have surgery as an option, but once you've done surgery, you cannot undo the surgery. But before the surgery, you can use all these other therapies to try to strengthen the tissue and hopefully not have to do the surgery.
Exactly.
And also you mentioned regulates metabolism. So I know we're dealing with obesity crisis, and everyone wants high metabolism. So can it help then in weight loss and reduction then of the obesity crisis that we're dealing with?
For example, we haven't used in obesity in reduced pounds, but we obtain, for example, a reduce in anxiety. Then we can say that sometimes in those patients that are obese, they have a crisis of anxiety and they eat more. Then using ozone in a certain way reduces anxiety, and then we can help those patients.
So they will eat less then? They will not be as hungry?
They will not have that anxiety, and then they will eat less.
Oh.
But also we have seen, for example, in diabetic patients with diabetic food, for example, that we have demonstrated certain anti-diabetic effect with ozone. It reduces the level of glucose in comparison with a control, for example. And that is important. They are regulating the metabolism. The mechanism of action, we are not real clear. But the effect is that we reduce the level of glucose. In patients with retinitis pigmentosa that have, in certain of them have very high level of cholesterol, but we reduce cholesterol with ozone. Then ozone is trying to regulate metabolism, to make things function well. Of course, it depends in what you have, no? In the disease, in the phase of the disease, but it helps.
Yeah, because now we are dealing with that's probably one of our biggest concerns is the metabolic disorders that we're all dealing with that leads then to, like you mentioned, diabetes, and then you have obviously the cardiovascular diseases, the heart diseases, where cholesterol becomes a big issue, and the cholesterol then goes to areas of inflammation. If the blood vessels are inflamed, then cholesterol will go there, and then ozone can help in that area. Exactly.
In that study that we have made in cardiopathy patients, we have reduced cholesterol and we have reduced low-density lipoproteins that are bad. They are the bad ones, the low-density lipoprotein.
Yes. And that is huge because most people, when they're dealing with cholesterol or heart disease, they are putting statins. And these statin drugs have so many side effects and so many negative impacts on the body. And then using the ozone instead, then obviously that would be a much better option. And also you, talking about diabetes, you also have then other issues with diabetes, like the neuropathy, or you have, the poor circulation, with lesions, and sometimes it can get to the point of needing.
We have a lot of experience in diabetic, mainly diabetic foot and diabetic neuropathy. That was the first disease we have treated in 1986 in Cuba, and due to the great results we have obtained in diabetic foot, we have created that Ozone Research Center. And in this case, we obtained the cure of the lesion, and in a high percentage, we avoid the amputation.
That's amazing.
And of course, we achieve the cellular redox balance because those patients will have a great number of free radicals.
Yeah.
And in diabetic neuropathy, We improve nerve conduction and amplitude and reduces pain. Of course, it is very important to say that ozone do not cure any chronic disease. It improves. And for obtain that improvement, that is very important, because if you don't have any other solution, then we have to repeat the cycle of ozone treatment at least every 6 months.
So
that's important to talk about the treatment that we recommend.
And what's important to understand, I mean, like the point you're making is that we are health exists in balance, and by supplying the body the components it needs to achieve balance, disease disappears. So
exactly.
It's not like we are using a natural agent to cure disease. We're using the natural agent to obtain health. And in a healthy state, we do not have disease. So, you cannot use, like you're saying, you can't say that ozone cures diabetes or ozone cures diabetic neuropathy. It doesn't do that. It just supplies the body the components that it needs in order to be able to shift from a diseased state to a healthy state.
Exactly.
So there's so many different uses and with ozone, and so what are some normal kind of therapies, treatment frequencies, depending on what kind of condition that you are dealing with. Let's say, for instance, you have somebody dealing with diabetes and they have diabetic neuropathy. What kind of frequency should that individual have?
Well, in general, we can apply ozone through different ways.
Yeah.
We can use parenteral or local treatments. And always we have to prevent to inhale the gas. And we can use, for example, major and minor autohemotherapy. Major is you extract the blood, you collect in a flask with anticoagulant, you bubble ozone inside, and then you reinfuse. This is the major autohemotherapy. The minor, for example, you extract 10 milliliters of blood, then you bubbles 10 milliliters of ozone in the same syringe, and then you inject it intramuscular. This is another way. But you can use ozone by intramuscular, subcutaneous, for example, injected in trigger points where you have pain, or bagging. This is a local treatment. You have a lesion, and then, for example, a diabetic foot, you put the leg inside a bag, a plastic bag, you fill with ozone, and that bag maybe for 30, 45 minutes, and then, you take it off. This is bagging. Or cupping, when you use a special cup, a plastic cup, the lesion is, for example, adapted to the cup, and then for one side, you enter the ozone, and for the other one, you make some vacuum. This is another way, is cupping. You can use vaginal. Also, you can use intrathecal or paravertebral, for example, in disc herniation, or you can use intradiscal in disc herniation, or intratonsillar, intraperitoneal, rectal, to the vaginal, urethral. You see, there are a lot of ways of ozone application, always avoiding the respiratory tract.
So that is pretty much the main key. You should not breathe in the ozone.
Exactly, because the concentration we use is a vasoconstrictor. Then you have to avoid this. And then we have different frequencies according to the way of application. For example, you can use major and minor autohemotherapy, or intramuscular, or subcutaneous, or bagging, or cupping, or vaginal. We can use daily. We can use 2 or 3 times per week, for example, when you are applying intrathecal or paravertebral or intratonsillar or urethral. And we can apply it once a week, for example, if we have intradiscal applications.
So
Normally, for example, for rectal, we applied 20 sessions, and we do it daily, Monday to Friday. If we applied autohemotherapy, we applied 15 treatments, for example, exactly Monday, the same Monday to Friday. But it's important, and I repeated, that this cycle of treatment has to be repeated at least every 6 months. But sometimes we have diseases, for example, Parkinson's, dementia, that we have to repeat it every 2 or 3 months. Then we have to personalize the treatment and make a protocol for each patient. If they needed this cycle of treatment every 2 months, every 3 months, every 6 months, independence of the patient, of the state of the disease.
Wonderful.
And if we compare, for example, major autohemotherapy with rectal, we have seen a more rapid effect with autohemotherapy in the first sessions. But at the end of the cycle of treatment, the results are the same. And what is important, that if you have a patient with a chronic disease that you have to apply frequently the treatment, if you are using major autohemotherapy, then your veins at the end will be destroyed. Then in that case, we recommend to use rectal in order to avoid damage to the vein.
Wonderful.
Then
when we
in Cuba, now we are using a lot rectal. It's less invasive, more economic,
yes,
less expensive, no side effect, and in children we use only rectal.
When we'll come back, it's amazing. I want to go through a little bit on some of the health conditions also that ozone has been used, so people can have an understanding of all the areas that it applies to. We'll be back in just a little bit. This is HealthMade Radio. I'm Dr. Michael Karlfeldt. I'm here with Dr. Sylvia Menendez, one of the leading authorities in the area of ozone therapy and medical use of ozone therapy. So we were talking a little bit about that, about research in regards to ozone therapy, and that we need more studies. Has there been any research so far proving ozone efficacy?
Well, we have demonstrated that ozone restores the cell redox balance. And considering that there are more than 200 oxidative stress-related diseases, well, this is a very important possibility that ozone offers. That ozone also achieves calcium homeostasis. That is very important in the activation. For example, in Parkinson's disease, we obtain an activation of N-methyl aspartate that increase the influx of calcium, and this produces a neuronal toxicity. Then ozone avoids that. Also, ozone modulates the levels of pro-inflammatory cytokines, activates prostacyclin, activates adenosine A1 receptors. And this activation of this adenosine A1 receptor supports new potential therapeutic application of ozone therapy in neurological diseases, such as epilepsy, pain, cerebral ischemia, anxious sleep disorders, Parkinson's, dementia. And also, well, we have obtained good results in clinical trials, like scleroderma, asthma, AIDS, neoarthritis, disherniation, rheumatoid arthritis, retinitis pigmentosa, peripheral vestibular cochlear syndrome, open field glaucoma, diabetic foot, Parkinson's, dementia, autism spectrum disorder, sudden deafness, ischemic cardiopathy, multiple sclerosis. You can see, though, due to the potentiality of ozone, we can use it in different diseases. And also, it's important that we have another branch of ozone therapy, the ozonated vegetable oil, that due to his capacity of regenerating the skin, giving the skin a glow, because they increase microcirculation, bringing more oxygen to the skin, combating acne, rosacea, eczema, allergic rashes, and many other skin problems, then are very important in ozone therapy, the use of ozonated vegetable oils. Now I'm in the United States. I'm the scientific director of a company that manufactures this kind of product. The name is Ozolabs, and the anti-aging and skin therapeutic results are really, really good. You can go to ozolabs.com to see the testimonials from doctor and other clients. And as final remarks, it's important to highlight that ozone therapy seems to induce a simultaneous resuscitation of functions that had gone wrong, from metabolic activation to immunomodulation, and from hormonal release to restoration of antioxidant defenses. The strength of ozone therapy is to reactivate and reequilibrate physiological activities. All this in order to favor the patients and to contribute to a better quality of life.
So this I think is crucial for people to understand. We can actually then get ozone therapy. There are oils that you made available, ozonated vegetable oils, where you can then apply ozone not to the skin, and obviously that has a very anti-aging, but also it helps for any skin conditions to help to regenerate the skin, and also allow to drive ozone into tissue, like for instance joints and any area where you have inflammation. And so I really appreciate you taking this step and making a quality product like this available because of the tremendous impact that ozone has on the body. And all the different diseases, it's hard to imagine that something so simple can have an impact in so many different areas, like Parkinson's, for instance. Talking about how it stops then the influx of calcium that can have that neurotoxic effect into the cells to help to improve symptoms like the tremble, the stiffness, the walking difficulties, and slowness of movement, and all of these things. Parkinson, we look at something so severe. And then you mentioned dementia. So many people are afraid of dementia and Alzheimer's, and they want to do everything they possibly can. And then ozone being able to help to support the oxygenation of the brain and reduce inflammation in the brain, and get rid of cholesterol in the brain. And then you have all the autoimmune disorders, where you can then combine it both with the immunosuppressant drugs like methotrexate, if you're talking about rheumatoid arthritis. And you can combine it and then making the methotrexate more effective. Or you can just try ozone by itself. So then for regeneration of skin, of joints, and it's just amazing what it does, all of these things. So I thank you so much, Dr. Menendez, for spending some time with me today, educating us about the healing benefits of ozone, and also for your dedication in finding these safe and effective treatments for chronic health conditions. That's all for today. I'm Dr. Michael Karlfeldt with HealthMade Radio. Health is what you make it.